Visa Success Series Q&A Course Review NCLEX Prep 9 Thousands of NCLEX Style Questions 9 Alternate Item Format Questions 9 Rationales for Correct and Incorrect Answers 9 Test Taking Tips Visit www.fadavis.com Keyword, Success Series to learn more. www.fadavis.com Davis mobile apps download today from your favorite app store. Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam Ray A. Hargrove Huddle, RN, PhD Catherine Cadenhead Colgrove, RN, MS, CNSFA Davis Company 1915 Arch Street EET Philadelphia, Pennsylvania 19103 www.fadavis.com Copyright 2014 by F.A. Davis Company Copyright 2014 by F.A. Davis Company. All rights reserved. This book is protected by copyright. No part of it may be reproduced, stored in a retrieval system, or transmitted in any form or by any means, electronic, mechanical, photocopying, recording, or otherwise, without written permission from the publisher. Printed in the United States of America. Last digit indicates print number, 109876543321 Publisher, Nursing, Robert G. Martoni Director of Content Development, Darlene D. Peterson Project Editor, Jacqueline C. Clay Electronic Project Editor, Sandra A. Glennie Illustration and Design Manager, Carolyn O'Brien. As new scientific information becomes available through basic and clinical research, recommended treatments and drug therapies undergo changes. The author, S., and publisher have done everything possible to make this book accurate, up to date, and in accord with accepted standards at the time of publication. The author, S., editors, and publisher are not responsible for errors or omissions or for consequences from application of the book, and make no warranty, expressed or implied, in regard to the contents of the book. Any practice described in this book should be applied by the reader in accordance with professional standards of care used in regard to the unique circumstances that may apply in each situation. The reader is advised always to check product information, package inserts, for changes and new information regarding dose and contraindications before administering any drug. Caution is especially urged when using new or infrequently ordered drugs. Library of Congress Cataloging in Publication Data. Library of Congress Cataloging in Publication Data. ISBN 978-0-80363313-1 Authorization to photocopy items for internal or personal use, or the internal or personal use of specific clients, is granted by F.A. Davis Company for users registered with the Copyright Clearance Center, CCC, Transactional Reporting Service, provided that the fee of $0.25 per copy is paid directly to CCC, 222 Rosewood Drive, Danvers, Massachusetts, 01923. For those organizations that have been granted a photocopy license by CCC, a separate system of payment has been arranged. The fee code for users of the Transactional Reporting Service is 978-0-80363313-1/14 plus $0.25. Thank you to all the nursing students, nursing faculty, and nursing colleagues we have had the privilege to work with during our careers. We want to thank Robert Martoni for his vision and support, who was there when our writing career started and has been with us every step of the way. Our thanks to computer extraordinaire Gladden Norris, who fixes our mistakes, makes the questions look pretty, and is responsible for making this book possible. Thank you to Catherine McAfee, who codes all the questions, leaving us time to write the questions. I want to thank all my friends for love, support, and prayers as I battled ovarian cancer this last year. Thanks to aunts, uncles, and cousins, my Los Angeles friends, my Trinity Valley Community College friends, my Texas friends, my Hawaiian friends, and the Lee girls. My thanks to my sisters Gail and Debbie, my nephew Ben, and Paula, who brought me home and cared for me. I thank my children Teresa and Aaron for making me want to get up every day and fight the fight. As always, I dedicate this book to my parents, T/SGT Leo R. Hargrove and Nancy, who made me believe I can do anything. I am an ovarian cancer survivor. Ray A. Hargrove Huddle, this was Ray's dedication. Ray lost her battle with cancer on December 23, 2012. She is much loved and greatly missed. Kathy Colgrove, I would like to dedicate this book to the memory of my mother, Mary Cadenhead, and grandmother, Elsie Rogers. They always told me I could accomplish anything I wanted to accomplish. I would also like to dedicate this book to my husband, Larry, children, Lori and Todd and Larry Jr. and grandchildren, Chris, Ashley, Justin C., Justin A., Connor, Sawyer, and Carson. Without their support and patience the book would not have been possible. Catherine Cadenhead Colgrove v. Reviewers Deborah Bailey, RN, PhD candidate, FNP, CDE Associate Professor of Nursing, Department Head Health Sciences Colorado Mesa University Grand Junction Colorado Patricia A. Bicknell, ed., APRN, ACNSBC, CNL Assistant Professor of Nursing. Track Coordinator for Clinical Nurse Leader, CNL, La Salle University Philadelphia Pennsylvania Donna Bowles, ed., MSN, CNE Associate Professor Indiana University Southeast New Albany Indiana Diane Cohen, RN, MSN Professor Mass Bay Community College Framingham Massachusetts Diane L. Cooper McLean, RN, BSN, MSN Nursing Instructor Faulkner State Community College Bay Minette Alabama Pamela DeWitt, RN, MN, CNE Residential Faculty Phoenix College Department of Nursing Phoenix Arizona Kathleen Walsh Free, MSN, RNC, APRNBC Clinical Professor Indiana University Southeast. T. New Albany Indiana Lynn D. Kennedy, MSN, RN Assistant Professor of Nursing Francis Marion University Florence South Carolina Maria McCormick, MSN, MS, RN Faculty Spence Ryan College Louisville Kentucky Mary Ann Siciliano McLaughlin, MSN, RN Faculty, Umdenge School of Nursing Stratford, New J.E. R.C. Elizabeth Murray, Ph.D., RN, CNE Assistant Professor Florida Gulf Coast University School of Nursing Fort Myers Florida L. Jane Rosati, ed., MSN, RNBC Assistant Chair/Program Manager of the ADN Program Daytona State College Daytona Beach Florida Faye Sigmund, Ph.D. Professor of Nursing Dyersburg State Dyersburg Tennessee Thomas Worms, RN, MSN Professor of Nursing Truman College Chicago, Illinois Poly Gerb. R. Zimmerman, RN, MS, MBA, Sen, FAEN Associate Professor Harry S. Truman College Chicago, Illinois 7 Table of Contents 1 Introduction to Prioritization, Assignment, Delegation, and Management 1 NCSBN Blueprint for Questions 1 Guidelines for Making a Decision 2 Types of Questions 4P. Putting the pieces together 5-2 Cardiovascular Management 7 Questions 7 Cardiac Clinical Scenario 20 Answers and Rationales 22 Clinical Scenario Answers and Rationales 43 Peripheral Vascular Management 43 Questions 43 Peripheral Vascular Diseases Clinical Scenario 54 Answers and Rationales 56 Clinical Scenario Answers and Rationales 74 for Respiratory Management 77 Questions 77 Respiratory Clinical Scenario 88 Answers and Rationales 90 Clinical Scenario Answers and Rationales 107 5 Gastrointestinal Management 109 Questions 109 Gastrointestinal Clinical Scenario 120 Answers and D. Rationales 122 Clinical Scenario Answers and Rationales 139 6 Renal and Genitourinary Management 141 Questions 141 Renal and Genitourinary Clinical Scenario 152 Answers and Rationales 154 Clinical Scenario Answers and Rationales 171 9x Table of Contents 7 Neurological Management 173 Questions 173 Neurological Clinical Scenario 185 Answers and Rationales 187 Clinical Scenario Answers and Rationales 204 8 Endocrine Management 207 Questions 207 Endocrine Clinical Scenario 220 Answers and Rationales 221 Clinical Scenario Answers and Rationales 238 9 Integumentary Management T239 Questions 239 Integumentary Clinical Scenario 250 Answers and Rationales 252 Clinical Scenario Answers and Rationales 269 10 Hematological and Immunological Management 271 Questions 271 Hematological and Immunological Clinical Scenario 282 Answers and Rationales 284 Clinical Scenario Answers and Rationales 299 11 Women's Health Management 301 Questions 301 Maternal Child Clinical Scenario 312 Answers and Rationales 314 Clinical Scenario Answers and Rationales 330 12 Pediatric Health Management 333 Questions 333 Pediatric Clinical Scenario 345 Answers and Rationales 347 Clinical Scenario Answers and Rationales 361 13 Mental Health Management 363 Questions 363 Mental Health Clinical Scenario 376 Answers and Rationales 378 Clinical Scenario Answers and Rationales 394 Table of Contents 1114 Case Studies, Care of Clients in Various Settings 397 Medical Nurse NG Case Study 397 Critical Care Nursing Case Study 400 Outpatient Nursing Case Study 403 Home Health Case Study 406 Mental Health Nursing Case Study 409 Maternal Child Case Study 412 Answers to Case Studies 414 15 Comprehensive Exam 429 Questions 429 Answers and Rationales 446 Appendix A Normal Laboratory Values 469 Glossary of English Words Commonly Encountered on Nursing Examinations 471 Index 475 1 Introduction to Prioritization, Assignment, Delegation, and Management 1 Each problem that I solved became a rule which served afterwards to solve other problems. René Descartes. This book is designed to assist the student nurse in nursing school and in taking nursing examinations, particularly the NCLEX-RN registered exam for licensure as a registered nurse, RN. Prioritization, delegation and management of care for the NCLEX-RN registered exam focuses on aspects of management such as setting priorities for client care, delegating and assigning nursing tasks, and managing clients and staff. It contains practice questions on these topics in a wide variety of nursing arenas, including medical, surgical, critical care, pediatric, geriatric, rehabilitation, home health, and mental health nursing. Answers and why each possible response is correct or incorrect are given for all questions. Management, prioritizing, and delegation questions are some of the most difficult questions for the student and new graduate to answer because there is no reference book in which to find the correct answers. Answers to these types of questions require knowledge of basic scientific principles, standards of care, pathophysiology and psychosocial behaviors, and leadership qualities and the ability to think critically. It is important to note that the test taker may not always agree with the author's rationale for the correct answer. It is poor test taking to read rationales for the incorrect answers. The students will remember reading the rationale but not if the rationale was for the correct or incorrect answer. Many of the answers in this book include tips to help the test taker. Termed Making Nursing Decisions, these tips provide help for the student in identifying exactly what the question is asking, in analyzing the question, and in determining the correct response. A comprehensive examination with answers and rationales is also included for each field of nursing. Practice questions and answers and practice examinations are valuable in preparing for an examination, but the test taker should remember that there is no substitute for studying the material. For general information on how to prepare for an examination and on the types of questions used in nursing examinations, refer to Fundamental Success, a Q&A review applying critical thinking to test taking by Patricia Nugent, RN, MA, MS, Ed, and Barbara Vital, RN, MA. NCSBN Blueprint for Questions. The National Council of State Boards of Nursing, NCSBN, provides a blueprint that assists nursing faculty in developing test questions for the NCLEX-RN registered. Content included in management of care provides and directs nursing care that enhances the care delivery setting to protect clients, family/significant others, and healthcare personnel. Related content includes, but is not limited to, advance directives, advocacy, case management, client rights, collaboration with the interdisciplinary team, delegation, establishing priorities, ethical practice, informed consent, information technology, and performance improvement. Other topics also include legal rights and responsibilities, referrals, resource management, staff education, supervision, confidentiality/information security, and continuity of care. The questions in this book follow this blueprint. Guidelines for making a decision. Nurses * base their decisions on many different bodies of information in order to arrive at a course of action. Among the basic guidelines to apply in nursing practice and in answering test questions are the nursing process and Maslow's hierarchy of needs. The nursing process. One of the basic guidelines to apply in nursing practice is the nursing process, which consists of 5 steps: assessment, nursing diagnosis, planning, intervention, and evaluation, usually completed in a systematic order. Many questions can be answered based on assessment. If a priority setting question asks the test taker which step to implement first, the test taker should look for an answer that would assess for the problem discussed in the stem of the question. Example 2: prioritization, delegation, and management of care for the NCLEX-RN registered exam. In this book, the term nurse, unless otherwise specified, refers to a licensed registered nurse, RN. An RN can assign tasks to an LPN or delegate to unlicensed assistive personnel, UAP, which may be known under other terms such as medical assistant or nurse's aide. An LPN can delegate tasks to UAP. Each state will have specific regulations that govern what duties/tasks can be delegated/assigned to each of these types of personnel. The term healthcare provider, as used in this book, refers to a client's primary provider of medical care. It includes physicians, including osteopathic physicians, nurse practitioners, NPS, and physician assistants, PA. Depending on state regulations, many NPS and some PA have prescriptive authority at least for some categories of prescribed drugs. The nurse is caring for a client diagnosed with congestive heart failure who is currently complaining of dyspnea. Which intervention should the nurse implement first? 1. Administer furosemide, Lasix, a loop diuretic, IVP. 2. Check the client for adventitious lung sounds. 3. Ask the respiratory therapist to administer a treatment. 4. Notify the healthcare provider. Answer: 2. Checking for adventitious lung sounds is assessing the client to determine the extent of the client's breathing difficulties causing the dyspnea. There are numerous words, such as check, that can be used to indicate assessment. The test taker should not discard an option because the word assess or assessment is not used. Alternatively, the test taker shouldn't assume that an option is correct merely because the word assess is used. The test taker must also be aware that the assessment data must match the problem stated in the stem, regardless of terminology. The nurse must assess for the correct information. If option 2 in the above example said, assess urinary output, it would not be a correct option even though it includes the word assess, since urinary output is not related to heart failure or breathing difficulties. In addition, the test taker should be aware that assessment is not always the correct answer when the question asks which should be done first. Suppose, for example, that the above question had listed option 3 as apply oxygen via nasal cannula at 2 lpm. In that case, assessment does not come first. The nurse would first attempt to relieve the client's distress and then assess. When a question asks what a nurse should do next, the test taker should determine from the information given in the question which steps in the nursing process have been completed and then choose an option that matches the next step in the nursing process. Example introduction: the client diagnosed with peptic ulcer disease has a blood pressure of 88/40 seconds, an apical pulse of 132, and respirations are 28. The nurse writes the nursing diagnosis: altered tissue perfusion related to decreased circulatory volume. Which intervention should the nurse implement first? 1. Notify the laboratory to draw a type and cross-match. 2. Assess the client's abdomen for tenderness. 3. Insert an 18-gauge catheter and infuse lactated ringers. 4. Check the client's pulse oximeter reading. Answer: 3. 1. Notifying the laboratory for a type and cross-match would be an appropriate intervention since the client is showing signs of hypovolemia, but it is not the first intervention because it would not directly support the client's circulatory volume. 2. The stem of the question has provided enough assessment data to indicate the client's problem of hypovolemia. Further assessment data are not needed. 3. The vital signs indicate hypovolemia, which is a life-threatening emergency that requires the nurse to intervene to support the client's circulatory volume. The nurse can do this by infusing lactated ringers. 4. A pulse oximeter reading would not support the client's circulatory volume. The nurse has assessed the client and formulated a nursing diagnosis. The next step in the nursing process is implementation. The nurse should proceed to a nursing intervention appropriate to the situation. These types of questions are designed to determine if the test taker can set priorities in client care. Maslow's hierarchy of needs: if the test taker has looked at the question and the nursing process can't help in determining the correct option, then using a tool such as Maslow's hierarchy of needs, Fig 1-1, can assist in choosing the correct answer. Remember that the bottom of the pyramid, physiological needs, represents the top priority in instituting nursing interventions. If a question asks the test taker to determine which is the priority intervention and a physiological need is listed among the options, then that is the priority. If a physiological need is not listed, safety and security take priority, and so on up the pyramid. Self-actualization, esteem and self-respect, belongingness and affection, safety and security, physiological needs, Figure 1-1. Maslow's hierarchy of needs. Chapter 1: Introduction to Prioritization, Assignment, Delegation, and Management. 3 types of questions. Most of the questions on the NCLEX-RN registered are multiple choice. The questions involve prioritizing client care, delegating staff tasks, and managing issues dealing with clients and staff. These questions may include interpreting medication administration records, MARS, knowing when notifying the primary health care provider, HCP, is priority, and knowing which tasks can be assigned to a licensed practical nurse, LPN, or unlicensed assistive personnel, UAP, and which must be performed by a registered nurse, RN. Some questions on the NCLEX-RN registered are termed alternate format questions and including choosing more than one option that correctly answers a question, ranking procedures or actions in correct order, drop and drag questions, and fill in the blank questions. Example: for prioritization, delegation, and management of care for the NCLEX-RN registered exam, the nurse is assigning tasks to the UAP. Which is an appropriate delegation to the UAP? Select all that apply. 1. Check the area around an incisional wound for redness. 2. Help a client with an upper limb cast to eat. 3. Assist a patient recovering from a hysterectomy to walk to the bathroom. 4. Explain to a client being discharged how to empty and clean the colostomy. 5. Transport a client with a suspected fractured tibia to the X-ray department. Prioritizing questions / setting priorities in test questions that ask the nurse which action to take first. 2 or more of the options will be appropriate nursing interventions for the situation described. When choosing the correct answer, the test taker must decide which intervention should occur first in a sequence of events, or which intervention directly impacts the situation. With a question that asks which client should the nurse assess first, the test taker should first look at each option and determine if the signs/symptoms the client is exhibiting are normal or expected for the disease process. If so, the nurse does not need to assess that particular client first. Second, if two or more of the options state signs/symptoms that are not normal or expected for the disease process, then the test taker should select the option that has the greatest potential for a poor outcome. Each option should be examined carefully to determine the priority by asking these questions: is the situation life-threatening or life-altering? If yes, this client is the highest priority. Is the situation unexpected for the disease process? If yes, then this client may be priority. Is the data presented abnormal? If yes, then this client may be priority. Is the situation expected for the disease process and not life-threatening? If yes, then this client may be but probably is not priority. Is the situation/data normal? If yes, this client can be seen last. The test taker should try to make a decision pertaining to each option. On pencil and paper examinations, it may be helpful to note the decision near the option. On a computerized test, the test taker should make the decision and move on to the next question. Delegating and assigning care. Although each state and province has its own nursing practice acts, there are some general guidelines that apply to all professional nurses. When delegating to an unlicensed assistive personnel, UAP, the nurse may not delegate any activity that requires nursing judgment. These include assessing, teaching, evaluating, or administering medications to any client and the care of any unstable client. When assigning care to an LPN, the RN can assign the administration of some medications but cannot assign assessing, teaching, or evaluating any client and cannot delegate the care of an unstable client. Management decisions. The nurse is frequently called upon to make decisions about staffing, movement of clients from one unit to another, or handling conflicts as they arise. Some general guidelines for answering questions in this area include the following: the most experienced nurse gets the most critical client. A graduate nurse can take care of any client who is receiving care from a student with supervision. The most stable client can move or be discharged, whereas the most unstable client must move to intensive care unit, ICU, or stay in ICU. When the nurse must make a decision regarding a conflict in the nursing station, a good rule to follow is to use the chain of command. The primary nurse should confront a peer, another primary nurse, or a subordinate unless the situation is illegal, such as stealing drugs. The primary nurse should use the chain of command in situations that address superiors, a manager or director of nursing. Then the nurse should discuss the situation with the next in command above the superior. Putting the pieces together, the nurse is required to acquire information, analyze the data, and make inferences based on the available information. Sometimes this process is relatively easy and at other times the pieces of information do not seem to fit. This is precisely where critical thinking and nursing judgment must guide in making the decision. Introduction. Chapter 1: Introduction to Prioritization, Assignment, Delegation, and Management. 5.7 Cardiovascular Management. 2 When you do the common things in life in an uncommon way, you will command the attention of the world. George Washington Carver. 1. The nurse on the cardiac unit has received the shift report from the outgoing nurse. Which client should the nurse assess first? 1. The client who has just been brought to the unit from the emergency department, ED, with no report of complaints. 2. The client who received pain medication 30 minutes ago for chest pain that was a level 3 on a 1 to 10 pain scale. 3. The client who had a cardiac catheterization in the morning and has palpable pedal pulses bilaterally. 4. The client who has been turning on the call light frequently and stating her care has been neglected. 2. The nurse on the cardiac unit is preparing to administer medications after receiving the morning change of shift report. Which medication should the nurse administer first? 1. The cardiac glycoside to the client who has an apical pulse of 58. 2. The loop diuretic to a client with a serum K+ level of 3.2 milliequivalent/L. 3. The antidysrhythmic to the client in ventricular fibrillation. 4. The calcium channel blocker who has a blood pressure of 110/68. 3. Which client should the telemetry nurse assess first after receiving the AM shift report? 1. The client diagnosed with deep vein thrombosis who has an edematous right calf. 2. The client diagnosed with mitral valve stenosis who has heart palpitations. 3. The client diagnosed with arterial occlusive disease who has intermittent claudication. 4. The client diagnosed with congestive heart failure who has pink frothy sputum. 4. The charge nurse is making assignments for clients on a cardiac unit. Which client should the charge nurse assign to a new graduate nurse? 1. The 44-year-old client diagnosed with a myocardial infarction. 2. The 65-year-old client admitted with unstable angina. 3. The 75-year-old client scheduled for a cardiac catheterization. 4. The 50-year-old client complaining of chest pain. Questions 5. The charge nurse is making assignments for a 30-bed cardiac unit staffed with 3 registered nurses, RNs, 3 licensed practical nurses, LPNs, and 3 unlicensed assistive personnel, UAPs. Which assignment is most appropriate by the charge nurse? 1. Assign an RN to perform all sterile procedures. 2. Assign an LPN to give all 4 medications. 3. Assign an UAP to complete the AM care. 4. Assign an LPN to write the care plans. 6. The nurse on a cardiac unit is discussing a client with the case manager. Which information should the nurse share with the case manager? 1. Discuss personal information the client shared with the nurse in confidence. 2. Provide the case manager with any information that is required for continuity of care. 3. Explain that client confidentiality prevents the nurse from disclosing information. 4. Ask the case manager to get the client's permission before sharing information. 7. The nurse assesses erratic electrical activity on the telemetry reading while the client is talking to the nurse on the intercom system. Which task should the nurse instruct the UAP to implement? 1. Call a code blue immediately. 2. Check the client's telemetry leads. 3. Find the nurse to check the client. 4. Remove the telemetry monitor. 8. The charge nurse on the cardiac unit has to float a nurse to the emergency department for the shift. Which nurse should be floated to the emergency department? 1. The nurse who has 4 years of experience on the cardiac unit. 2. The nurse who just transferred from critical care to the cardiac unit. 3. The nurse with 1 year of experience on the cardiac unit who has been on a week's sick leave. 4. The nurse who has worked in the operating room for 2 years and in the cardiac unit for 3 years. 9. The cardiac nurse is preparing to administer 1 unit of blood to a client. Which interventions should the nurse implement? Rank in order of priority. 1. Infuse the unit of blood at 20 GTTS/min the first 15 minutes. 2. Check the unit of blood and the client's blood band with another nurse. 3. Initiate Y-tubing with normal saline via an 18-gauge angiocatheter. 4. Assess the client's vital signs and lung sounds, and assess for a rash. 5. Obtain informed consent for the unit of blood from the client. 10. The charge nurse in the cardiac critical care unit is making rounds. Which client should the nurse see first? 1. The client with coronary artery disease who is complaining that the nurses are being rude and won't answer the call lights. 2. The client diagnosed with an acute myocardial infarction who has an elevated creatinine phosphokinase cardiac muscle, CPKMB, level. 3. The client diagnosed with atrial fibrillation on an oral anticoagulant who has an international normalized ratio, INR, of 2.8. 4. The client 2 days postoperative coronary artery bypass who is being transferred to the cardiac unit. 11. The nurse is preparing to administer digoxin 0.25 mg IVP to a client in severe congestive heart failure who is receiving D5W/0.9 NaCl at 25 ml/hr. Rank in order of importance. 1. Administer the medication over 5 minutes. 2. Dilute the medication with normal saline. 3. Draw up the medication in a tuberculin syringe. 4. Check the client's identification band. 5. Clamp the primary tubing distal to the port. 8. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. 12. The client is in the cardiac intensive care unit on dopamine, a vasoconstrictor, and B/P increases to 210/130. Which intervention should the intensive care nurse implement first? 1. Discontinue the client's vasoconstrictor, dopamine. 2. Notify the client's healthcare provider. 3. Administer the vasopressor hydralazine. 4. Assess the client's neurological status. 13. The charge nurse is making client assignments in the cardiac critical care unit. Which client should be assigned to the most experienced nurse? 1. The client with acute rheumatic fever carditis who does not want to stay on bed rest. 2. The client who has the following ABG values: pH, 7.35, PAO2, 88, PACO2, 44, HCO3, 22. 3. The client who is showing multifocal premature ventricular contractions, PVCs. 4. The client diagnosed with angina who is scheduled for a cardiac catheterization. 14. The primary cardiac nurse is delegating tasks to the unlicensed assistive personnel, UAP. Which delegation task warrants intervention by the charge nurse of the cardiac unit? 1. The UAP is instructed to bathe the client who is on telemetry. 2. The UAP is requested to obtain a bedside glucometer reading. 3. The UAP is asked to assist with a portable chest X-ray. 4. The UAP is told to feed a client who is dysphagic. 15. The nurse is administering medications to clients in the cardiac critical care area. Which client should the nurse question administering the medication? 1. The client receiving a calcium channel blocker, CCB, who is drinking a glass of grapefruit juice. 2. The client receiving a beta-adrenergic blocker who has an apical heart rate of 62 beats/min. 3. The client receiving nonsteroidal anti-inflammatory drugs, NSAIDs, who has just finished eating breakfast. 4. The client receiving an oral anticoagulant who has an international normalized ratio, INR, of 2.8. 16. The charge nurse on the cardiac unit is counseling a female staff nurse because the nurse has clocked in late multiple times for the 7 a.m. to 7 p.m. shift. Which conflict resolution uses the win-win strategy? 1. The charge nurse terminates the staff nurse as per the hospital policy so that a new nurse can be transferred to the unit. 2. The charge nurse discovers that the staff nurse is having problems with child care, therefore, the charge nurse allows the staff nurse to work a 9 a.m. to 9 p.m. shift. 3. The charge nurse puts the staff nurse on probation with the understanding that the next time the staff nurse is late to work she will be terminated. 4. The staff nurse asks another staff member to talk to the charge nurse to explain that she is a valuable part of the team. 17. Which client warrants immediate intervention by the nurse? 1. The client diagnosed with pericarditis who has chest pain with inspiration. 2. The client diagnosed with mitral valve regurgitation who has thready peripheral pulse. 3. The client diagnosed with Marfan syndrome who has pectus excavatum. 4. The client diagnosed with atherosclerosis who has slurred speech and drooling. Chapter 2 Cardiovascular Management 9 Questions 18. The UAP working in a long-term care facility notifies the nurse that the client diagnosed with congestive heart failure who is on a low-sodium diet is complaining that the food is inedible. Which intervention should the nurse implement first? 1. Have the family bring food from home for the client. 2. Check to see what the client has eaten in the past 24 hours. 3. Tell the client that a low-sodium diet is an important part of the diagnosis. 4. Ask the dietitian to discuss food preferences with the client. 19. The charge nurse on the cardiac unit is making shift assignments. Which client should be assigned to the most experienced nurse? 1. The client diagnosed with mitral valve stenosis. 2. The client diagnosed with asymptomatic sinus bradycardia. 3. The client diagnosed with fulminant pulmonary edema. 4. The client diagnosed with acute atrial fibrillation. 20. The evening nurse in a long-term care facility is preparing to administer medications to a client diagnosed with atrial fibrillation. Which medication should the nurse question administering? 10. Prioritization, delegation, and management of care for the NCLEX-RN registered exam client, MR. A date: today medication warfarin, Coumadin, 5 mg per daily metoclopramide, Reglan, 5 mg per TID docusate, Colis, po beta-atorvastatin, Lipitor, po daily nurse's name/initials admit number, 654,321 height, 71 inches weight, 77.2. 7 kg/170 pounds 0701 to 1500 0900 DN 1300 DN 0900 DN Day Nurse RN/DN Allergies, Penicillin Diagnosis, Atrial Fibrillation 1501 to 2300 2301 to 0700 1800 INR, 3.4/today 1800 1800 1800 Evening Nurse RN/N1. Warfarin, Coumadin, an anticoagulant. 2. Metoclopramide, Reglan, a gastric motility medication. 3. Docusate, Colis, a stool softener. 4. Atorvastatin, Lipitor, an anti-hyperlipidemic. 21. The nurse and the UAP enter the client's room and discover that the client is unresponsive. Which action, according to the American Heart Association, AHA, guidelines, should the nurse assign to the UAP first? 1. Ask the UAP to check whether the client is asleep. 2. Tell the UAP to perform cardiac compressions. 3. Instruct the UAP to get the crash cart. 4. Request the UAP to put the client in a recumbent position. 22. The elderly client on a cardiac unit has a do not resuscitate, DNR, order written. Which intervention should the nurse implement? 1. Continue to care for the client's needs as usual. 2. Place notification of the DNR inside the client's chart. 3. Refer the client to a hospice organization. 4. Limit visitors to 2 at a time, so as not to tire the client. 23. The nurse is initiating discharge teaching to a 68-year-old male client who had quadruple coronary bypass surgery. Which priority question should the nurse ask the client? 1. Are you sexually active? 2. Can you still drive your car? 3. Do you have pain medications at home? 4. Do you know when to call your HCP? 24. The LPN informs the clinic nurse that the client diagnosed with atrial fibrillation has an INR of 4.5. Which intervention should the nurse implement? 1. Tell the LPN to notify the clinic healthcare provider, HCP. 2. Instruct the LPN to assess the client for abnormal bleeding. 3. Obtain a stat electrocardiogram on the client. 4. Take no action because this INR is within the normal range. 25. The nurse at a disaster site is triaging victims when a woman states, "I am a certified nurse aide. Can I do anything to help?" Which action should the nurse implement? 1. Request the woman to please leave the area. 2. Ask the woman to check the injured clients. 3. Tell the woman to try and keep the victims calm. 4. Instruct the woman to help the paramedics. 26. The cardiac clinic nurse hears the UAP tell the client, "You have gained over 15 pounds since your last visit." The scale is located in the office area. Which action should the clinic nurse implement? 1. Tell the UAP in front of the client to not comment on the weight. 2. Ask the UAP to put the client in the room and take no action. 3. Explain to the UAP, in private, that this is an inappropriate comment and violates HIPAA. 4. Report the UAP to the Director of Nurses of the clinic. 27. The nurse on the cardiac unit is discussing case management with a client who asks, "Why do I need a case manager for my heart disease?" Which statements are most appropriate for the nurse to respond? Select all that apply. 1. Case management helps contain the costs of your health care. 2. It will help enhance your quality of life with a chronic illness. 3. It decreases the fragmentation of care across many healthcare settings. 4. Case management is a form of health insurance for clients with chronic illnesses. 5. We try to provide quality care along the healthcare continuum. 28. The client diagnosed with arterial hypertension and has been taking a calcium channel blocker, a loop diuretic, and an ACE inhibitor for 3 years. Which statement by the client would warrant intervention by the nurse? 1. I have to go to the bathroom a lot during the morning. 2. I get up very slowly when I have been sitting for a while. 3. I do not salt my food when I am cooking it, but I add it at the table. 4. I drink grapefruit juice every morning with my breakfast. 29. The director of nurses in the cardiac clinic is counseling an unlicensed assistive personnel, UAP, in the clinic who returned late from her lunch break 7 times in the past 2 weeks. Which conflict resolution uses the win-lose strategy? 1. The UAP explains she is checking on her ill mother during lunch, and the nurse allows her to take a longer lunch break if she comes in early. 2. The director of nurses offers the UAP a transfer to the emergency weekend clinic so that she will be off during the week. 3. The director of nurses terminates the UAP, explaining that all staff must be on time so that the clinic runs smoothly. 4. The UAP is placed on 1-month probation, and any further occurrences will result in termination from this position. Chapter 2 Cardiovascular Management 11 Questions 30. The cardiac clinic nurse has told the female unlicensed assistive personnel, UAP, twice to change the sharps container in the examination room, but it has not been changed. Which action should the nurse implement first? 1. Tell the UAP to change it immediately. 2. Ask the UAP why the sharps container has not been changed. 3. Change the sharps container as per clinic policy. 4. Document the situation and place a copy of the documentation in the employee file. 31. The wife of a client calls the clinic and tells the nurse her husband is having chest pain but won't go to the hospital. Which action should the nurse implement first? 1. Instruct the wife to call 911 immediately. 2. Tell the wife to have the client chew an aspirin. 3. Ask the wife what the client had to eat recently. 4. Request the husband talk to the clinic nurse. 32. The home health, HH, nurse received phone messages from the agency secretary. Which client should the nurse phone first? 1. The client diagnosed with hypertension who is reporting a BP of 148/92. 2. The client diagnosed with cardiomyopathy who has a pulse oximeter reading of 93%. 3. The client diagnosed with congestive heart failure who has edematous feet. 4. The client diagnosed with chronic atrial fibrillation who is having chest pain. 33. The client is diagnosed with end-stage congestive heart failure. The nurse finds the client lying in bed, short of breath, unable to talk, and with buccal cyanosis. Which intervention should the nurse implement first? 1. Assist the client to a sitting position. 2. Assess the client's vital signs. 3. Call 911 for the paramedics. 4. Auscultate the client's lung sounds. 34. The home health, HH, nurse is visiting a client diagnosed with congestive heart failure. The client has an out-of-hospital do not resuscitate, DNR, order, has stopped breathing, and has no pulse or blood pressure. The client's family is at the bedside. Which intervention should the HH nurse implement first? 1. Contact the agency's chaplain. 2. Pronounce the client's death. 3. Ask the family to leave the bedside. 4. Call the client's funeral home. 35. The cardiac nurse received laboratory results on the following clients. Which client warrants immediate intervention from the nurse? 1. The client who has an INR of 2.8. 2. The client who has a serum potassium level of 3.8 milliequivalent/L. 3. The client who has a serum digoxin level of 2.6 mg/dl. 4. The client who has a glycosylated hemoglobin of 6%. 36. The home health, HH, nurse is completing the admission assessment for an obese client diagnosed with a myocardial infarction with comorbid type 1 diabetes and arterial hypertension. Which priority intervention should the nurse implement? 1. Encourage the client to walk 30 minutes a day. 2. Request an HH-registered dietitian to talk to the client. 3. Refer the client to a cardiac rehabilitation unit. 4. Discuss the client's need to lose 1 to 2 pounds a week. 37. The home health, HH, nurse is preparing for the initial visit to a client diagnosed with congestive heart failure. Which intervention should the HH nurse implement first? 1. Prepare all the needed equipment for the visit. 2. Call the client to arrange a time for the visit. 3. Review the client's referral form/pertinent data. 4. Make the necessary referrals for the client. 12. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. 38. Which information should the experienced home health, HH, nurse discuss when orienting a new nurse to HH nursing? 1. If the client or family is hostile or obnoxious, call the police. 2. Carry the HH care agency identification in a purse or wallet. 3. Visits can be scheduled at night with permission from the agency. 4. Inform the agency of the times of the client's scheduled visits. 39. The home health, HH, aide tells the HH nurse that the grandson of the client she is caring for asked her out on a date. Which statement is the HH nurse's best response? 1. I am so excited for you, he seems like a very nice young man. 2. You should not go out with him as long as she is a client of our agency. 3. I think you should tell the director of the HH care agency about this date. 4. You should never date someone you meet while taking care of a client. 40. The cardiac nurse is teaching the client diagnosed with congestive heart failure. Which teaching interventions should the nurse discuss with the client? Select all that apply. 1. Notify the healthcare provider, HCP, if the client gains more than 2 pounds in one day. 2. Keep the head of the bed elevated when sleeping. 3. Take the loop diuretic once a day before going to sleep. 4. Teach the client which foods are high in sodium and should be avoided. 5. Perform isotonic exercises at least once a day. 41. The nurse is administering medications on a cardiac unit. Which medication should the nurse question administering? 1. Warfarin, Coumadin, an anticoagulant, to a client with a prothrombin time, PT, of 14 and an international normalized ratio, INR, of 1.6 mg/dl. 2. Digoxin, Lanoxin, a cardiac glycoside, to a client with a potassium level of 3.3 milliequivalent/L. 3. Atenolol, Tenormin, a beta blocker, for the client with an ASP irate aminotransferase, AST, of 18 U/L. 4. Lisinopril, Zestril, an ACE inhibitor, for the client with a serum creatinine level of 0.8 mg/dl. 42. The nurse is providing end-of-life care to the client diagnosed with cardiomyopathy who is in hospice. Which priority assessment intervention should the nurse implement? 1. Assess the client's spiritual needs. 2. Assess the client's financial situation. 3. Assess the client's support system. 4. Assess the client's medical diagnosis. 43. The husband of the client diagnosed with infective endocarditis and who has a do not resuscitate, DNR, tells the nurse, my wife is not breathing. Which intervention should the nurse implement first? 1. Contact the client's healthcare provider, HCP. 2. Notify the rapid response team. 3. Stay with the client and her husband. 4. Instruct the UAP to perform post-mortem care. 44. The hospice nurse is triaging phone calls from clients. Which client should the nurse call first? 1. The client whose family reports the client is not eating. 2. The client who wants to rescind the out-of-hospital DNR. 3. The client whose pain is not being controlled with the current medications. 4. The client whose urinary incontinence has caused a stage 1 pressure ulcer. 45. The hospice nurse is working with a volunteer. Which task could the nurse delegate to the volunteer? 1. Sit with the client while he or she reminisces about life experiences. 2. Give the client a sponge bath and rub lotion on the bony prominences. 3. Provide spiritual support for the client and family members. 4. Check the home to see that all necessary medical equipment is available. Chapter 2 Cardiovascular Management 13 Questions 46. The nurse delegates post-mortem care to the unlicensed assistive personnel, UAP. The UAP tells the nurse she has never performed post-mortem care. Which statement is the best response by the nurse to the UAP? 1. It can be uncomfortable. I will go with you and show you what to do. 2. The client is already dead. You cannot hurt him now. 3. There is nothing to it, it is just a bed bath and change of clothes. 4. Don't worry. You can skip it this time, but you need to learn what to do. 47. The unlicensed assistive personnel, UAP, tells the nurse the client is complaining of chest pain. Which task should the nurse delegate to the UAP? 1. Call the healthcare provider, HCP, and report the client's chest pain. 2. Give a client some acetaminophen, Tylenol, while the nurse checks the client. 3. Get the client's medical records and bring them to the client's room. 4. Notify the client's family of the onset of chest pain. 48. The registered nurse, RN, and licensed practical nurse, LPN, are caring for a group of clients on a cardiac unit. Which nursing task should not be assigned to the LPN? 1. Feed the client who has N4 in both forearms. 2. Assess the client diagnosed with stage 4 heart failure. 3. Discharge the client who had a cardiac catheterization. 4. Administer the intravenous piggyback, IVPB, antibiotic ceftriaxone, Rosfin. 49. The hospice nurse is discussing the client's care with the unlicensed assistive personnel, UAP. Which statement contains the best information about caring for a client with end-stage heart failure who is dying? 1. Perform as much care for the client as possible to conserve his or her strength. 2. Do not get too attached to the client because it will hurt when he or she dies. 3. Be careful not to promise to withhold healthcare information from the team. 4. The client may want to talk about his or her life, but you should discourage that. 50. The client on telemetry is showing ventricular tachycardia. Which action should the telemetry nurse delegate to the unlicensed assistive personnel, UAP? 1. Have the UAP call the operator and announce the code. 2. Tell the UAP to answer the other call lights on the unit. 3. Send the UAP to the room to start rescue breaths. 4. Ask the family to step out of the room during the code. 51. The female family member of the client experiencing a cardiac arrest refuses to leave the client's room. Which intervention should the administrative supervisor implement? 1. Stay with the family member and explain what the team is doing. 2. Call hospital security to escort the family member out of the room. 3. Ask the healthcare provider, HCP, whether the family member can stay. 4. Ignore the family member unless she becomes hysterical. 52. The male client presents to the emergency department with a complaint of chest pain but does not have the ability to pay for the services. Which action should the emergency department nurse implement first? 1. Place the client on a telemetry monitor and assess the client. 2. Call an ambulance to transfer the client to a charity hospital. 3. Have the client sign a form agreeing to pay the bill. 4. Ask the client why he chose to come to this hospital. 53. The nurse is caring for clients on a cardiac unit. Which client should the nurse assess first? 1. The client diagnosed with angina who is reporting chest pain. 2. The client diagnosed with CHF who has bilateral 4+ peripheral edema. 3. The client diagnosed with endocarditis who has a temperature of 100 degrees Fahrenheit. 4. The client diagnosed with aortic valve stenosis who has syncope. 14. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 54. Which medication should the nurse administer first after receiving the morning shift report? 1. The IVPB antibiotic to the client with endocarditis admitted at 0530 today. 2. The antiplatelet medication to the client who had a myocardial infarction. 3. The coronary vasodilator patch to the client with coronary artery disease. 4. The statin medication to the client diagnosed with atherosclerosis. 55. The nurse in a critical care cardiac unit is administering medications to a client. Which intervention should the nurse implement first? 1. Check the radial pulse before administering digoxin, a cardiac glycoside. 2. Monitor the amiodarone level for the client receiving amiodarone. 3. Obtain the latest PTT results on the client with a heparin drip. 4. Check the liver function panel for the client receiving a dopamine drip. 56. The surgical nurse is admitting a client having heart surgery to the operating room. Which information would require the nurse to call a timeout? 1. The client is drowsy from the preoperative medication and drifts off to sleep. 2. The consent form states mitral valve replacement and the client states aortic valve replacement. 3. The chart and client's armband states the client is allergic to the narcotic analgesic morphine. 4. The client states his or her name and birth date as it appears on the chart. 57. The nurse is administering medications at 1800 to a client and uses the following medication administration record, MAR. Which intervention should the nurse implement first? Chapter 2 Cardiovascular Management 15 questions. Client's name, CC diagnosis, heart failure medication digoxin, lanoxin, 0.1. 25 mg per daily furosemide, Lasix, 40 mg IVP daily cephalosporin 1800, Keflex, 500 mg per every 6 hours warfarin, Coumadin, 5 mg per daily. Nurse name / initials account number, 45,678 to 98 weight, 178 pounds 0701 to 1500 0900 DN 0900 DN 1200 DN Day Nurse RN / DN Allergies, NKDA height, 68 inches. 1501 to 2300 2301 to 0700 1800 1800 Evening Nurse RN / N1. Assess the client's potassium and digoxin levels. 2. Monitor the client's partial thromboplastin level. 3. Check the client's international normalized ratio, INR. 4. Verify the client's name and identification, ID, number with the MAR. 58. The nurse is administering medications to clients on a cardiac unit. Which medication should the nurse question administering? 1. The loop diuretic furosemide, Lasix, to a client who had a 320 ml output in 4 hours. 2. The anticoagulant enoxaparin, Lovenox, to a client who had open heart surgery. 3. The antiplatelet ticlopidine, Ticlid, to a client being prepared for surgery. 4. The ACE inhibitor captopril, Capoten, to a client who has a B/P of 100/68. 59. The intensive care unit nurse and a UAP are caring for a client who has had a coronary artery bypass graft, CABG. Which nursing task should the nurse assign to the UAP? 1. Monitor the client's arterial blood gases. 2. Reinfuse the client's blood using the cell saver. 3. Assist the client to take a sponge bath. 4. Change the client's saturated leg dressing. 60. The nurse is preparing to administer 2 units of PRBCs to a client diagnosed with congestive heart failure, CHF. Which HCP order should the nurse question? 1. Administer each unit over 2 hours. 2. Administer the loop diuretic furosemide, Lasix, IVP once. 3. Restrict the client's fluids to 1000 ml per 24 hours. 4. Have a complete blood count, CBC, done the following morning. 61. The elderly client on the cardiac unit was found on the floor by the bed. Which information should the nurse document in the client's chart? 1. Fell. No injuries noted. Incident report completed. HCP notified. 2 found on floor. No complaints of pain. Able to move all extremities. 3 states no one answered call light, so attempted to get up without help. 4. Got out of bed without assistance and fell by the bedside. 62 The home health, HH, nurse is caring for an elderly client. Which nursing task should the nurse delegate to the HH aide? 1. Cook and freeze meals for the client. 2. Assist the client to sit on the front porch. 3. Take the client for outings to the store. 4. Monitor the client's mental status. 63 The client admitted to rule out R/O, a myocardial infarction, is complaining of substernal chest pain radiating to the left arm and jaw. Which intervention should the nurse implement first? 1. Take the client's pulse, respirations, and blood pressure. 2. Call for a stat electrocardiogram and a troponin level. 3. Place sublingual nitroglycerin 1/150 g under the tongue. 4. Notify the HCP that the client has pain. 64 The client on the cardiac unit has a cardiac arrest. Which is the administrative supervisor nurse's first intervention during the code? 1. Begin to take notes to document the code. 2. Make sure all the jobs are being done. 3. Arrange for an intensive care unit bed. 4. Administer the emergency medications. 65. Which client should the cardiac nurse assess first after receiving the PM shift report? 1. The client who is completing the second unit of PRBCs. 2. The client who is crying after being informed of a terminal diagnosis. 3. The client who refused to eat the dietary tray but got food from home. 4. The client who became short of breath ambulating in the hallway. 16. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. 66. The nurse is caring for Mr. AB, a client on a telemetry unit. At 0830 the client complains of chest pain. Which medication should the nurse administer? Chapter 2 Cardiovascular Management. 17 questions. Client name, Mr. AB. Height, 72 inches. Date, today. Signature/initials. Account number, 112-2337. Weight in pounds, 202. Weight in kg, 91.8. 2. Medication morphine sulfate 2 mg IVP every 1 hour. PRN chest pain oxycodone 7.5/acetaminophen 325 mg PO every 4 hours. PRN pain Maalox 30 ml PO. PRN indigestion nitroglycerin 0.4 mg/SL every 5 minutes up to 3 tablets. PRN chest pain nitroglycerin transdermal cream 1/2 inch. Allergies, meperidine. Date of birth, January 5, 1945. 0701-1500-0900. Apply day nurse RN/DN 2301-07000030 NN 0545 NN night nurse RN/NN 1501-2300 2100. Remove 1. Administer 1/2 inch of nitroglycerin transdermally now. 2. Morphine sulfate 2 mg IVP stat. 3. Oxycodone 7.5 mg/acetaminophen 325 mg PO now. 4. Nitroglycerin 0.4 mg sublingual stat. 2. Mr. RS, who is scheduled for a coronary artery bypass graft, CABG, this morning. 18. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. Client name, RS. Account number, 885-5992. Allergies, sulfa. Diagnosis, coronary. Height, 73 inches. Weight in pounds, 248. Artery disease. Weight in kg, 112.7. 3. Laboratory report. Lab test. Client value normal value apt 11:10 to 13 seconds. INR 1.02.0 to 3.0. Therapeutic value, APTT 34:25 to 35 seconds. WBC 5.94.5 to 11.0, 103 mm, RBC 4.9 male, 4.7 to 5.1, 106 cells/mm, female, 4.2 to 4.8, 106 cells/mm, hemoglobin 13.5 male, 13.2 to 17.3 G/DL female, 11.7 to 15.5 G/DL hematocrit 44.2 male, 43%, 49% female, 38%, 44% platelets 292 150 to 450, 103 millimeters, client name, TR account number, 665-5774 allergies, penicillin diagnosis, chest height, 62 inches weight in pounds, 200 pain weight in kg, 90.9. Laboratory report lab test client value normal value app 12:10 to 13 seconds INR 1.0 2.0 to 3.0, therapeutic value, APTT 29:25 to 35 seconds 3. Ms. TR, who had a cardiac cauterization 18 hours ago. 67 The charge nurse on a cardiac unit has received laboratory reports to assess. Which lab report is priority for the charge nurse to assess? 1. Ms. CT, who is on a heparin drip. Client name, CT. Account number, 223-3669 allergies, NKDA diagnosis, deep vein height, 66 inches weight in pounds, 132 thrombosis weight in kg, 60 laboratory report lab test client value normal value app 15:10 to 13 seconds INR 1.4 2.0 to 3.0, therapeutic value, APTT 56:25 to 35 seconds 68. The nurse on a medical unit is making rounds after receiving the shift report. Which client should the nurse see first? Rank in order of priority. 1. The 45-year-old client who complained of having chest pain at midnight last night and received NTG sublingually. 2. The 62-year-old client who is complaining that no one answered the call light for 2 hours yesterday. 3. The 29-year client diagnosed with septicemia who called to request more blankets because of being cold. 4. The 78-year-old client diagnosed with dementia whose daughter is concerned because the client is more confused today. 5. The 37-year-old client who has a stage 4 pressure sore and the dressing needs to be changed this morning. 69. While ambulating in the hallway with the nurse, the client diagnosed with myocardial infarction complains of chest pain. Which interventions should the nurse implement? Select all that apply. 1. Administer nitroglycerin 0.4 mg sublingual stat. 2. Have the client walk back to the room. 3. Take the client's vital signs. 4. Place the client on supplemental oxygen. 5. Ask the ward secretary to call the healthcare provider for orders. 70. The nurse received an APTT report on a client receiving heparin via continuous drip infusion. According to the report, the client's drip rate should be decreased by 100 units per hour. The heparin comes prepared as 25,000 units in 500 ml of fluid. The current rate of infusion is 26 ml per hour. At what rate should the nurse set the pump? Chapter 2 Cardiovascular Management 19 questions Client name, JE account number, 625-1489 allergies, NKDA diagnosis, R/O gall height, 68 inches weight in pounds, 198 bladder disease weight in kg, 90 laboratory report lab test client value normal value app 9.8 10 to 13 seconds INR 1.3 2.0 to 3.0. Therapeutic value, APTT 26:25 to 35 seconds platelet 392 150 to 450, 103 millimeters, 4. Mr. J.E., who was admitted to rule out gallbladder disease. 20 Prioritization, delegation, and management of care for the NCLEX-RN registered exam. Ms. Teresa is the 7A, 7P charge nurse on 24-bed telemetry unit. There are 4 RNs, 2 LPNs, 2 UAPs, 2 telemetry technicians, and 1 unit secretary working on the unit along with Ms. Teresa. There are 20 clients in the unit. 1. Which client should Ms. Teresa assign to the most experienced RN on the unit? 1. the client diagnosed with atrial fibrillation who is receiving the first dose of Praxada, dabigatran. 2. The client diagnosed with congestive heart failure who is coughing up pink, frothy sputum. 3. The client diagnosed with a myocardial infarction who is exhibiting occasional premature ventricular contractions. 4. The client diagnosed with mitral valve prolapse who is complaining of shortness of breath when sitting in the chair. 2. The telemetry technician tells the primary nurse the client in room 420 has a straight line. Which intervention should the primary nurse implement first? 1. Instruct the UAP to take the crash cart to room 420. 2. Tell the telemetry technician to call the rapid response team. 3. Determine if the client has an apical pulse and blood pressure. 4. Check to see if the client has the telemetry leads on the chest. 3. The primary nurse has instructed the unlicensed assistive personnel, UAP, to assist the client in 410 to the bathroom for a shower. Which action by the UAP warrants intervention by the primary nurse? 1. The UAP did not notify the desk the telemetry was being removed. 2. The UAP did not remove the electrodes from the client's chest. 3. The UAP placed a bath chair in the shower for the client. 4. The UAP stayed in the client's bathroom while the client showered. 4. Ms. Teresa is looking over the morning laboratory results. Which client warrants Ms. Teresa notifying the healthcare provider, HCP? 1. The client receiving IVP digoxin who has a digoxin level of 2.4 mg/dl. 2. The client receiving Coumadin, warfarin, who has an INR of 1.2. 3. The client receiving furosemide who has a potassium level of 3.5 milliequivalent/L. 4. The client receiving nistadin who has a cholesterol level of 205. 5. Which client should Ms. Teresa assign to the LPN? 1. The client who was just admitted from the emergency department to the unit. 2. The client who is exhibiting supraventricular tachycardia on the telemetry. 3. The client who had a left femoral cardiac catheterization this morning. 4. The client who needs teaching concerning coronary artery disease. 6. Ms. Teresa is transcribing the healthcare provider's admissions orders for a client being admitted for R/O myocardial infarction. Which HCP's order should Ms. Teresa question? 1. Draw cardiac isoenzymes every 6 hours. 2. Provide low-fat, low cholesterol diet. 3. Administer morphine IVP 2 mg every 5 minutes for chest pain. 4. Schedule client for endoscopy in AM. 7. Which nursing task is most appropriate for Ms. Teresa to delegate to the UAP? 1. Request the UAP to obtain the newly admitted client's weight. 2. Ask the UAP to clean the room for the client who has been discharged. 3. Tell the UAP to take the vital signs on the client who is hypovolemic. 4. Instruct the UAP to discuss the low-fat, low cholesterol diet with the client. Cardiac Clinical Scenario Chapter 2 Cardiovascular Management 21 Questions 8. The client in room 420 is complaining of severe chest pain of 10 on a 1 to 10 pain scale. Which intervention should the nurse implement first? 1. Check the client's MAR for the last time medication was administered. 2. Assess the client's apical pulse, blood pressure, and lung sounds. 3. Administer a sublingual nitroglycerin to the client. 4. Place oxygen via nasal cannula at 6L/min. 9. The client is in ventricular tachycardia. Which intervention should the nurse implement first? 1. Defibrillate the client. 2. Assess the carotid pulse. 3. Administer epinephrine IVP. 4. Start cardiopulmonary resuscitation. 10. Ms. Teresa is completing discharge teaching for the client diagnosed with angina. Which statement indicates the client needs more teaching? 1. I must keep my nitroglycerin tablets in a dark bottle at all times. 2. I should walk at least 30 minutes at least 3 times a week. 3. I will decrease the number of cigarettes I smoke daily. 4. I am going to take 1 baby aspirin every day. 22 Prioritization, delegation, and management of care for the NCLEX-RN registered exam. The correct answer number and rationale for why it is the correct answer are given in boldface type. Rationales for why the other possible answer options are incorrect also are given, but they are not in boldface type. 1. This client may or may not be stable. The client may have no complaints at this time, but the nurse must assess this client first to determine whatever the complaint was that brought the client to the ED has stabilized. This client should be seen first. 2. It is important for the nurse to assess for pain relief in a timely manner, but this client has been medicated and the pain was a 3. The nurse can evaluate the amount of pain relief after making sure that the ED admission is stable. 3. This client has been back from the procedure and a bilateral pedal pulse indicates the client is stable, therefore, this client does need to be seen first. 4. Psychological issues are important, but not more so than a physiological issue, and the client admitted from the ED may have a physiological problem. Content, medical/surgical, category of health alteration, cardiovascular, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The test taker should use some tool as a.r. efferents to guide in the decision-making process. In this situation, Maslow's hierarchy of needs should be applied. Physiological needs have priority over psychosocial ones. 2.1. The cardiac glycoside, such as digoxin, should not be administered unless the apical pulse is 60 or above. 2. Because the client's serum K+ level is already low, the nurse should question administering a loop diuretic. 3. The client in ventricular fibrillation is in a life-threatening situation, therefore, the antidysrhythmic, such as lidocaine or amiodarone, should be administered first. 4. The client's blood pressure is above 90/60ths, so the calcium channel blocker can be administered, but it is not priority over a client who is in a life-threatening situation. Content, medical/surgical, category of health alteration, cardiovascular, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. The test taker should know which medication NS are priority, such as life-threatening medications, insulin, and mucolytics, carafate. These medications should be administered first by the nurse. 3.1. The nurse would expect the client with a deep vein thrombosis to have an edematous right calf, so the nurse would not need to assess this client first. 2. The nurse would expect the client with mitral valve stenosis to have heart palpitations, sensations of rapid, fluttering heartbeat. 3. The nurse would expect the client with arterial occlusive disease to have intermittent claudication, leg pain, so the nurse would not need to assess this client first. 4. The client would not expect the client with congestive heart failure to have pink, frothy sputum because this is a sign of pulmonary edema. This client should be assessed first. Content, medical/surgical, category of health alteration, cardiovascular, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The test taker must determine which sign/s symptom is not expected for the disease process. If the sign/symptom is not expected, then the nurse should assess the client first. This type of question is determining if the nurse is knowledgeable of signs/symptoms of a variety of disease processes. 4.1. This client is at high risk for complications related to necrotic myocardial tissue and will need extensive teaching, therefore, this client should not be assigned to a new graduate. 2. Unstable angina means this client is at risk for life-threatening complications and should not be assigned to a new graduate. 3. A new graduate should be able to complete a pre-procedural checklist and get this client to the catheterization lab. Answers and Rationales Chapter 2 Cardiovascular Management 23-4. Chest pain means this client could be having a myocardial infarction and should not be assigned to a new graduate. Content: medical/surgical, category of health alteration, cardiovascular, integrated nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions, when the test taker is deciding which client should be assigned to a new graduate, the most stable client should be assigned to the least experienced nurse. 5.1. An LPN can perform sterile procedures such as inserting indwelling catheters and forecatheters. An RN should perform the functions that require nursing judgment, such as planning and evaluating the care of the clients. 2. Although an LPN could administer most intravenous piggyback, IVPB, medications, only qualified RNs may administer intravenous push, IVP, medications and chemotherapy. 3. A UAP is capable of performing the morning care. This is an appropriate nursing task to delegate. 4. Writing a care plan for a client requires nursing judgment, therefore, an RN should be assigned this function. Content: medical/surgical, category of health alteration, cardiovascular, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. An RN cannot delegate assessment, teaching, evaluation, medications, or an unstable client to a UAP. Tasks that cannot be delegated are nursing interventions that require nursing judgment. Remember that in most instances, options with the word all, options 1 and 2, can be eliminated because if the test taker can think of one time when some other level of licensure could safely perform the task, then the option automatically becomes wrong. 6.1. Unless the information shared is directly connected to healthcare issues, the nurse should not share confidential information with anyone else. The nurse should inform clients that information directly affecting the client's healthcare will be shared on a need-to-know basis only. 2. The case manager's job is to ensure continuity and adequacy of care for the client. This individual has a need to know. 3. The case manager is part of the healthcare team, therefore, information should be shared. 4. The client gave permission when being admitted to the hospital for information to be shared among those providing care. The case manager does not need to obtain further consent. Content: medical/surgical, category of health alteration, cardiovascular, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, knowledge-making nursing decisions. The test taker must be knowledgeable of the role of each member of the multidisciplinary healthcare team as well as HIPAA rules and regulations. These topics will be tested on the NCLEX-RN registered exam. 7.1. The telemetry strip indicates an artifact, so there is no need for the UAP or any staff member to call a code blue, which is used when someone has arrested. 2. The UAP should be instructed to check the telemetry lead placement. This reading cannot be ventricular fibrillation because the client is talking to the nurse over the intercom system. This telemetry is an artifact, therefore, the leads should be checked and the UAP can do this because the client is stable. 3. The UAP can take care of this problem. There is no need for the primary nurse to check the client. 4. The strip indicates an artifact, but there is no indication that the client should be removed from telemetry. Content: medical/surgical, category of health alteration, cardiovascular, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application making nursing decisions. An RN cannot delegate assessment, teaching, evaluation, medications, or an unstable client to a UAP. Tasks that cannot be delegated are nursing interventions requiring nursing judgment. 8.1. The nurse who just has surgical nursing experience would not be the choice to flow to the emergency department. 2. The nurse with critical care experience would be the best choice to flow to the emergency department. 3. The nurse just returning from sick leave would not be a good choice to send to the emergency department, which may be very busy at times. 4. This nurse has not had experience in critical care, therefore, this nurse would not be the best choice to flow to the emergency department. Answers 24. Prioritization, delegation, and management of care for the NCLEX-RN registered exam content, medical/surgical, category of health alteration, cardiovascular, integrated processes, nursing, process, planning, client needs, safe and effective care environment, management of care, cognitive. E-level, synthesis making nursing decisions. The nurse needs to know management issues for the RN NCLEX registered. The nurse with experience in certain areas of nursing would be most appropriate to flow to the areas with related types of clients, such as critical care and the emergency department. 9. Correct answer, 5, 4, 3, 2, 1. 5. The nurse must first obtain informed consent prior to administering the blood product. 4. The nurse needs to complete the pre-transfusion assessment, including assessing for any signs of allergic reaction prior to administering the unit of blood. 3. The blood must be hung with Y tubing and normal saline, and an 18-gauge angiocatheter is preferred. 2. The nurse must check the unit of blood from the laboratory with another nurse and with the client's blood band. 1. During the first 15 minutes, the blood transfusion must be administered slowly to determine if the client is going to have an allergic reaction. Content: adult health, cardiac, category of health alteration, cardiovascular, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions. This is an alternate type of question and included in the NCLEX-RN registered blueprint. The nurse must be able to perform skills in the correct order. Obtaining informed consent and assessment should always be the first interventions. 10.1. The charge nurse is responsible for all clients. At times it is necessary to see clients with a psychosocial need before other clients who have situations that are expected and are not life-threatening. 2. An elevated CPKMB, cardiac isoenzyme, level is expected in a client with an acute myocardial infarction. Therefore, the charge nurse would not see this client first. 3. The INR is within the normal limits of 2 to 3, therefore, this client does not need to be assessed first. 4. This client is being transferred to the cardiac unit. Therefore, the client is stable and does not require the charge nurse to see this client first. Content: medical/surgical, category of health alteration, cardiovascular, integrated processes, nursing process, assessment, client needs, psychosocial integrity, cognitive level, analysis making nursing decisions. The test taker must determine if any of the assessment data is normal or abnormal for the client's diagnosis. If the data is abnormal, then this client should be seen first. If the data is normal, then a client with a psychosocial problem is the client the nurse should assess first. 11. Correct answer, 3, 2, 4, 5, 1. 3. Because this is less than 1 ml, the nurse should draw this medication up in a 1 ml tuberculin syringe to ensure accuracy of dosage. 2. The nurse should dilute the medication with normal saline to a 5 to 10 ml bolus to help decrease pain during administration and maintain the foresight longer. Administering 0.25 mg of digoxin in 0.5 ml is very difficult, if not impossible, to push over 5 full minutes, which is the manufacturer's recommended administration rate. If the medication is diluted to a 5 to 10 ml bolus, it is easier for the nurse to administer the medication over 5 minutes. 4. The nurse must check 2 identifiers according to the Joint Commission safety guidelines. 5. The nurse should clamp the tubing between the port and the primary 4 line so that the medication will enter the vein, not ascend up the 4 tubing. 1. Cardiovascular and narcotic medications are administered over 5 minutes. Content: medical/surgical, category of health alteration, cardiovascular, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, application making nursing decisions. This is an alternate type of question that is included in the NCLEX-RN registered blueprint. The nurse must be able to perform skills in the correct order. 12.1. The nurse should first discontinue the medication that is causing the increase in the client's blood pressure prior to doing anything else. 2. The nurse should notify the HCP but not prior to taking care of the client's elevated blood pressure. Chapter 2 Cardiovascular Management 25.3. The client may need a medication to decrease the blood pressure, but the nurse should first discontinue the medication causing the elevated blood pressure. 4. The nurse must first decrease the client's blood pressure prior to assessing the client. Content: medical/surgical, category of health alteration, cardiovascular, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions. The test taker should remember that when the client is in distress, do not assess. The nurse must intervene and take care of the client. If any of the options is assessment data the HCP will need or an intervention that will help the client, then the test taker should not select the option to notify the HCP. 13.1. The client with rheumatic heart fever is expected to have carditis and should be on bed rest. The nurse needs to talk to the client about the importance of being on bed rest, but this client is not in a life-threatening situation and does not need the most experienced nurse. 2. These ABG values are within normal limits, therefore, a less experienced nurse could care for this client. 3. Multifocal PVCs are an emergency and are possibly life-threatening. An experienced nurse should care for this client. 4. A cardiac catheterization is a routine procedure and would not require the most experienced nurse. Content: medical/surgical, category of health alteration, cardiovascular, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The test taker must determine which client is the most unstable and would require the most experienced nurse, thus making this type of question an accept question. 3 clients are either stable or have non-life-threatening conditions. 14.1. All clients in the ICU are on telemetry, and the UAP could bathe the client. This would not warrant intervention by the charge nurse. 2. The UAP can perform glucometer checks at the bedside, and there is nothing that indicates the client is unstable. This would not warrant intervention by the charge nurse. 3. The UAP can assist with helping the client sit up for a portable chest X-ray as long as the UAP is not pregnant and wears a shield. 4. This client is at risk for choking and is not stable, therefore, the charge nurse should intervene and not allow the UAP to feed this client. Content: medical/surgical, category of health alteration, cardiovascular, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application making nursing decisions. This is an accept question. The test taker could ask which task is appropriate to delegate to the UAP. 3 options would be appropriate to delegate and 1 would not be. Remember, the RN cannot delegate assessment, teaching, evaluation, medications, or an unstable client to the UAP. 15.1. The client receiving a CCB should avoid grapefruit juice because it can cause the CCB to rise to toxic levels. Grapefruit juice inhibits cytochrome P450-3A4 found in the liver and the intestinal wall. This inhibition affects the metabolism of some drugs and can, as is the case with CCBs, lead to toxic levels of the drug. For this reason, the nurse should investigate any medications the client is taking if the client drinks grapefruit juice. 2. The apical heart rate should be greater than 60 beats/minute before administering the medication, therefore, the nurse would not question administering this medication. 3. Nonsteroidal anti-inflammatory drugs, NSAIDs, should be taken with foods to prevent gastric upset. Therefore, the nurse would not question administering this medication. 4. The INR therapeutic level for warfarin, Coumadin, an anticoagulant, is 2 to 3, therefore, the nurse would not question administering this medication. Content, medical/surgical, category of health alteration, cardiovascular, integrated processes, nursing process, planning, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, knowledge-making nursing decisions, the test taker must be knowledge-able of medications. In most scenarios, there is no test-taking hint to help the test taker when answering medication questions except common nursing interventions, such as do not administer cardiac medications if client has a P60 or B/P90/60ths, do not administer medications with grapefruit juice or antacids, or Answers 26. Prioritization, delegation.